Now let's see the Paschimottanasana. Somebody want to practice the Paschimottanasana? For the Paschimottanasana, as we're sitting like that, as you're practicing every day in a class, we don't have so much time to use so many props when you are, especially when you are practicing in Ashtanga Yoga. We don't have so much time to adjust yourself, use the strap, block, or blanket or bolster. But yeah, when you're practicing by yourself, you can go more deeper into this position. See, when we bend our spine this position, so it's not only the movement is not only coming from the lower spine. We'll try to create the movement from the hips. So see, in this position, as you're sitting on the floor, it's quite challenging to tilt the hip forward, okay, like that tilting action. So in a forward bend require that anterior tilt of your pelvic, okay, and backward bend posture. We already talked in downward facing dog. Remember what I said? Tilt your hip forward, tailbone up. So in this position, you're pointing the tailbone backward, which gives the more length to the spine. Now, if somebody having the stiffness on the hamstring, it's quite challenging to make that tilt. So trying to make that tilt by ourselves, how we can do? Two options. First, you can try with a bend knee, which will help you to make you more able to tilt your hips forward. Or second way, if we are like, for example, to make the tilting action, if we are constantly pushing the flush the backward direction, like if you pull that like pulling from here and maintain this, it will maintain the tilt. But if you relax, it will drop it backward. So maintain that tilt by pulling the buttocks backward direction. What you're going to do here, we use the blanket, okay. But see how we're going to use the blanket. We don't sit on the blanket like that. We'll use the blanket like we'll roll it, we fold it. So we'll make a nice roll here, so which will give us that tilting action for our buttocks, which make our spine more longer and which give the more intense stretch to our back. Okay, for example, I make this roll with a blanket. Now how are we going to sit on the blanket? Even you can use the bolster, but as you go more higher and more higher, we'll have the more stretch on the back of the knee. It's not actually a stretch, it's become a stress after a while. You know, if somebody have a hyperextension, so it become a stress, not a stretch, because we don't have the muscles here. It's just a ligament tendons here, okay. There is no muscle. This is a muscle, this is a muscle. These are not muscles, you know, like a big muscles. They are just a skin fascia which is covering your back of the knee, the ligament and tendons. So here, remember, in the joints we do not have the stretch, okay. We're using the range of motion, mobility, or yeah, and we do not get the stretch on those reasons. We get the stress on the joint. For example, elbow. Okay, in order to stretch your biceps, you have to straighten your arm, of course. But if you go like that, I lose the control of my biceps now, and I start to having the stress on my elbow because I'm moving it more than the range. So now, similarly with the knee. Now, as I sit on the blanket, so how are you going to sit on the blanket or bolster? Remember, we need that anterior tilt for the hips. So I'm not going to sit on the back side. If I sit back, it's helping me to roll backward. So I'm going to sit on the front side of the blanket. So it helped me to like pull my buttocks backward. So you don't have to make effort to keep the back straight. Okay. And see, now I have a hyperextension, my knees come to the floor now. Or if I push them more down, so what happens, for after a while, they will start to stressing my back of the knee so much because I'm stretching the ligament and tendons here. I'm not stretching any muscles here. If I keep like that, okay, that's totally safe for me. But if you sit on the bolster, make sure you get some height also here, back of the knees. No need to push the knees down. So do you want to try to sit on the blanket? Yeah. Sit on the inner edge of, pull the flush out backward by yourself first. Yeah. Is okay? Yeah. Yeah. So, and also you will have the more stretch here now as you straight the leg. So sitting on the blanket like that, really nice way, and you can feel your back become more taller. You don't have to be like that in a sitting position, Dandasana or any for the Paschimottanasana. So, and second thing, now see come to the legs. Remember, some few of you, I think I told that day what happened when you do the Paschimottanasana on our legs. So most of the time when you do the forward bend, we're just relaxing our legs like that. Okay, so now see, look at her leg. If I'm rolling her leg, this is the internal, I'm moving her toes inward. So see what happened, legs are moving apart and we are relaxing our inner side of the leg. If I roll her like outer arch of the feet, like backward direction, you see the legs are rolling inward and you can feel the more sharpness on the inner side of the leg. Okay, to maintain that sharpness or that nice extension on the inner side of the leg, in order to fall forward, in order to improve the elasticity in our hamstring, we have to work on to rolling our legs a little bit inward. And by how rolling, I'm not saying, okay, you roll your legs like that. Okay, just simply action, try to push the outer arch of your feet forward, will give the nice extension your inner side of the legs. And you're gonna push the inner side of the feet like forward and outer arches of the feet backward. You try with the both way, but if somebody having the back pain, okay, remember, if somebody having the back pain, if you do the same way, it stresses the back more. See, very micro momentum we do in our body, it really gives the different effect. You can also feel by yourself every time. For example, she have the back pain. If she does like that Paschimottanasana, I'm sure she will have the more pressure on the back. But the same way, if she roll her legs like outward and then she do the Paschimottanasana, it will really make the difference. Now we'll check it later, but let's see for Paschimottanasana. For normally, if you do not have any back pain, so you're sitting like that, you roll the inner arches of the feet forward and try to pushing the heels forward in this position, and make sure the both legs are equally. You know, some people, they push the right leg more further or left leg more further, Margot. So trying to make sure that your both legs are in a one line, not a one longer and one shorter. See, otherwise what happens, if the one leg is more longer, you get the more stretch on the one side, less stretch on the other side. And it affecting all the posture, which you do with both side, right side or left side, right side. So make sure it's aligned. So now in this position, you press the fingertip and lift the sides of the trunk, lifting from the sides of the body nicely, working on the extension of the spine. And then here you can raise the arms up and stretch your arms higher, nicely, longer arms here. So every time when you're taking your arms up in a Urdhva Hastasana, Hasta Uttanasana, what are you going to do? You try to lift from the scapula. So you're trying to lift from the scapula to all the way to the armpit and create one nice movement from the biceps. That is the internal movement of the bicep. You try to roll your biceps and see what happened to the shoulder by yourself. Roll your bicep, only the biceps. Yeah, okay, roll your entire arm. What happened to the bicep and shoulder? Nothing happened?
They're facing each other more, no?
Yeah, like that. What happened to the shoulder? Your shoulder get broadened away from the ear. When you roll the biceps, you feel a deltoid, it moves away from the ear. Okay, that's the external rotation of the arms. Okay, that's the external rotation of the shoulder. Okay, now sometimes we get confused. We take our arms here. So if I ask you relax, relax. If I ask you roll your arms externally, yeah, relax, arms down. Now just take the arms all the way up. Relax, roll your arms externally. You got it? Yeah, okay, good. But see, what happened is confusing. Here, external rotation. Here, external rotation. But here, when you're rolling like that, we feel, some people think it's the internal movement because they are rolling it like that. But it's actually external rotation. Okay? That's the external, it's the same movement. I'm doing here, I'm doing here, I'm doing here. Or same in front of here, in front of my chest. The same movement. So some people, they get confused and they call it internal rotation. Okay? It's a little quite, tricky, so don't get confused if somebody saying, okay, rolling the arms externally here. So most of the people, they does like the external rotation because it's going like that. So they think this is the external movement of the shoulder, but actually it's the internal movement. Okay, so here we're going to work on the external movement. So what happens when you create the external rotation in our shoulder, our upper arm? So what happens? It move our deltoid away from the ear. So every position when you take your arms up, Urdhva Hastasana, upper arms rolling inward, means you're creating the external rotation, which move your shoulder away from the ear. Then you put your palms together and looking upward. So shoulder get away from the ear, not collapsing like that. Okay, let's try now. Continue. Now take your arms up. Yeah, rolling the biceps, and it also helping us to improve the flexion of the shoulder and give the deepen stretch. So see, also you feel by yourself. Can you please roll your arms like inward? Yeah, like that, and push the arms back. Do you feel something here?
Yeah.
Little bit, right?
Yeah.
Now roll it opposite direction and push it back. Do you feel more now?
Yeah, much more.
Much more now. So when you more rolling the external rotation and push the arms backward, you get the more stretch for the armpit region. But when you try from here, no stretch. This part becomes softened. No elongation on the sides of the trunk. Let's try. You okay?
Yeah.
Yeah, let's try. So you take your arms up, take a deep inhalation here, press the pelvic on the floor, press the sitting bone strongly, lifting from the sides of the body, and as you exhale, look front, slowly go with the straight back, keep stretching, slowly, as much possible, and take your toes. You can hold your toes, you can hold your foot on the, as much possible. Very nice. So once you make a bind in this position, again remember you're going to work on the rolling the feet forward and lifting from the front part of the body. Remember, as I say every time you do the forward bend, be aware of the chest and abdominal region. Make sure that you are not collapsing your belly. You collapse the belly, we get the round. Is okay for you?
Yeah.
We can be here for a while, right? How do you feel when you're rolling your legs like inward?
Okay.
Yeah, it's okay? Doesn't make sense? No? Okay, relax a little bit. Now, how does it feel?
Easier.
Easier, right? Okay, so you can be like that. Okay, it's fine. So lifting from the front of the body, chest higher, make your spine longer, and keeping the shoulder away from the ear. Or see, will not push ourselves here, but as you exhale in the air, you're bending your elbows. So the purpose of the bending the elbows, see here, the purpose of the bending the elbows here is really nice. You can get the more stretch if you see, if you know how to using the arm strength. Okay, I'm not gonna push her. See, we'll try here by yourself a little bit slowly, and look up slowly. Yeah, like that. Okay, we're gonna work on the keep the back straight as much possible, but she's not gonna round the back. She's having the back pain, it can be more worse. Or second option, what we can do if we're having the back pain, stiffness, or even for example, we cannot push yourself more down. So we don't need to round our back in this position. Actually, you can round your back when you're sitting. Most of the time when you're sitting like that, okay? So in this way, you can try softly bend the knees. Can you please, a little bit? Yeah. So as you bend your knees, so it doesn't stretch your, of course, it doesn't stretch your back of the knees, back of the thighs so much, but it can help you to release the tension from the lower spine and make your spine more straight in Paschimottanasana. Slowly, yeah, you're keeping the elbow. Now, for example, when you keep your elbows higher, what are you going to do? Just imagine that someone pulling your arms from here to backward direction in front of you. For example, if I hold her arms and I'm trying to pull her leg slowly. So as I'm pulling from here sides of the body, can you feel your sides of the trunk? What happened to here? You get the more stretch from the sides of the body. Is okay for you?
Yeah.
Yeah. So for example, when you keep your elbow bent and push yourself forward, it gives the sharp stretch from the sides of the trunk. Otherwise, you're getting the stretch only back and back of the legs. But as well as if you maintain the extension from the sides of the body, we can have the nice longer spine in this position. Okay, when you're making a little bit effort. But when you drop the elbow down, so you're relaxing the armpit region. This side of the body get collapsed or relaxed. Okay, and also it's hard to open the chest then because you're rounding your back. But as you keep the elbow high, you can also do like that. But when it's like that, it's hard to lift the chest up. So you lift the elbows and open the chest and pushing the arms forward and out to a direction and forward towards me as much possible by yourself in Paschimottanasana. All right, you okay?
Yeah.
Then slowly come up, head up, and take your arms up back to center, and then relax. All right, you okay?
Yeah.
I want to push, but I don't want to push you. Someone else. Yeah, someone else. Okay, now let's continue now. Can you please try Paschimottanasana? Hold your feet, hold your toes, take your arms up, stretch up. Yeah, sit a little bit front side. Yeah, like that. Now fold forward, catch your toes. Lift your head up, straight your back. Keep the back straight here. Now, lifting from the sides of the body, chest up. Yeah, like that. Is okay for you? Yeah. Now, as you exhale, bend your elbows and fold forward. Yeah, keep looking forward. Yeah, keep making the spine longer. Now, for example, as you getting in this position, so just imagine you're somebody pulling your arms forward. Yeah, keep the elbows up and push the elbows forward. Yeah, as much possible. See what happened as you start pushing from the elbow, you will have the more sharp stretch from the sides of the body. You get the more extension on the sides of the trunk, which allow you to flex the spine, which allow you to make your spine. Why? Yeah, you can pull her. It's okay. You can pull her. It's fine. But but you try by yourself, like pulling upward. Is okay. Yeah, but this is also fine. It gives the sharp stretch from the sides of the body. This way also we can assisting, but the another way which is much more better. So what are you gonna do? For example, as a partner, if you're assisting somebody in this position, so we'll go behind the partner. Okay, there are several adjustments. So one of the adjustment, what we're gonna do here, I will adjust my hands on her floating ribs. Remember in a Uttanasana, also I'll help the partner to hold the ribs and pull it down. So same here, now she's in sitting position, I hold her ribs and I will try to give some directional touch with my finger, like trying to make her aware that lift from here. So when you touch your finger, but not very deeply, like, not very strongly, don't break the floating ribs. But yeah, a little bit, make sure you're adding some pressure, otherwise they really doesn't make that movement. So I want to make her to make that extension movement. So I hold her floating ribs, I'll try to press and push a little bit forward so that she gets a little momentum, and I use my thumb to wrap around her back. Take a breathe in As she breathe out, I from here trying to pull her forward. I'm not pushing her down. I'm trying to like pull her like forward, 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 as much she can go. And then I will ask her by yourself, push the elbows out and up and bringing the head down, if possible, slowly, slowly like that. So from here, I'm trying to pull her like forward action, pulling forward. I'm not pressing her like that. Okay, this is not a good moment. Actually, it's not safe actually. It's not safe at all. So I hold from here. I lift her chest up and push a little bit forward in this position, okay? But if some people really rounding the back, she is doing well as well. Some people really rounding the back and all the time dropping the head down or getting them big round in the back. So also we can guide them by, can you please look front? So keep the hand on the back like here and use your one hand on the shoulder and like trying to pull up. So what I did, I using my knee to push her back and also same time lifting her shoulder upward, just to make the back straight here, okay? The back get longer in the starting position. So I want you to stay here, okay? Once you come here, I hold her here and then exhale slowly, slowly. I push her chest forward by using my hands, slowly, slowly. Keep looking front, elbows high, Mundi. Yeah, elbows high, elbows high, elbows high, elbows high, elbows high. Very good, stay there. Take a few breaths. Relax. So slowly lifting from the side and pushing your partner forward. You can try like that, okay? And also from the front side, somebody finding difficult to keep the back straight or having the too much roundness on the back, we can ask them, can you please hold my arm with the both hand? Hold tightly. Yeah, don't scare. Keep your back straight. So I adjust my ankles on her feet and I will ask her to lift your head up and I'm trying to pull her a little bit kind of slowly with my both hands. I hold like that as you feel comfortable with the one arm, or either you can hold the both arms. Can you hold my forearms? Like that. But I keep my feet closer to her heel. Inhale, look front, head up and push your chest forward, forward towards me. Yeah, you're gonna flex your spine slowly, slowly down, down. I'm trying to pulling this action slowly, slowly, slowly to get a little bit more stretch on the front of the thigh. Is okay? Yeah? Stay here for a bit.
Oh, sorry, my knee is
It's painful for the knee?
Yeah, it's not painful, it's just not very happy.
The inner side,
It goes like that.
it goes by yourself, yeah, so you have to keep something under the knees. That's what I'm trying to say. When you do the forward bend with the bend knee, micro, I don't say do like that. A micro bend knee, for example, instead from here, this position, most of the time you do like that, we lock the knee. So I'm not saying you bend your knee like that. If you just subtle bend the knee like that, that's really completely safe movement for the spine. So also see, if you keep your knee here like that, you can engage the quads muscle in this position. But once you keep your knee completely locked, we lose the contraction of the quads here. Okay, if you keep the knee like that, you're using the quads muscles to stabilizing the knee. It's strengthening your knee muscles, quads muscles as well. Okay, if you lock, no any benefit, no any contraction of the quad. We're just relaxing in this position. I can be relaxed here for a long time. Okay, but if I do like that a little bit, of course I'm making effort here to keep my knee stable here. So what it does, it helps us to allow to go more deep into the forward bend and also reduce the chances of the injury in our knees. Okay, if instead to locking the knee or locking the elbows like that. Let's try one more time. Take your arms up, stretch up and fold forward. Catch your toes, hook tightly and head up and fold forward with the exhalation. Second way of assisting, we can, as I already saw you, you can sitting from front or from here, you can help your partner to just stretch their back slowly, like pulling the arms slowly. But see, when you pull the arms, we cleanse the shoulder like that. We completely block the shoulder. So make sure that your partner is keeping the shoulder away from the ear and then trying to pull them slowly. It becomes kind of challenging when you are pulling from the front side. The best one I suggest to push your partner from the back. Or second way, if you feel okay, it's hard for you to push with the hands, you can keep the one bolster. You can go closer, you can push without body weight instead to pushing the hand. So you adjust the bolster, push the chest, head up. So I use my hand the same way. From here, I'm lifting her up. And with the exhalation, I'll try to push her forward and pressing with my chest very slowly in this position. Okay, it's optional as you feel comfortable. With the body weight or slowly with your hands by using your fingertip, lifting from here or pulling up and then flexing the spine. Okay, slowly relax. Now, second one of the way we can do by ourselves as a self-adjustment, same way as you're practicing in a Uttanasana. So you have the loop, you're going to make one big loop, a little bit, nice loop. And you're going to adjust the strap. How you adjust strap by yourself? You adjust from the back, is more comfortable. So you take the strap and sit like that. And adjust strap on your back and the thigh, keep your knees bent. Oh, guessed. Here. You adjust the strap closer to the thigh, make it tight, and then get into the asana. Let's try. Mundi. It's okay, it's fine.
He's fine. Wait, no. What am I doing?
Yeah, from your back, you adjust your buttocks inside the loop. Yeah, and pull it up on your upper back and bend your knees, knee to the chest. Yeah, like that. Now bring it closer, more, yeah, to the thigh, and also the strap more up on the upper back. What you're gonna do here, you're gonna keep the strap a little bit tight. Will let me help you. So carefully, when you assist yourself here, can you bring the chest closer to the thigh? Take a breathe in and breathe out. Chest up, chest up, chest up. Look front, take a breathe in and breathe out. Is okay? Now, so once you tie the strap here, so what are you gonna do in this position? You're gonna slowly lift your toes up and catch your toes, and so slide your legs forward. So as you're sliding your legs forward, slide your leg forward. Is okay? Yeah. Slide your legs forward. As you're sliding your legs forward, you have the already lock there. Okay, if you slide your legs forward, more forward, more forward, more. So you don't have to make effort to bringing the torso down. So as you push, you need to just straight your leg. As you straight the legs, yeah. As you straight the leg, the strap will help you to pull. Like before I was helping her to push her chest forward. Now the strap will help her to pull forward, pull down. And she can get more deeper in this position by pushing the legs forward. It's really nice way you can try it by yourself. You don't need any partner here to help you to flex your spine in this position. You can be longer, you can keep the elbows high, you can pushing the elbows more forward, you can have the more nice longer spine in this position in a Paschimottanasana without any partner help. Okay, you stay here a few breaths. As you release the posture, same way, lift your head up, you press the palms, sides of the knees and push your heel, pull your heel backward and then release the strap. Yeah, good. So you release the strap, untie yourself, you're done. Paschimottanasana. Okay?